Hi everyone, I'm here to talk to you today about a harmful condition that affects millions of men and women daily. It's about a sexually transmitted infection called Trichomoniasis, or Trich for short. The parasite Trichomonas vaginalis is what's responsible for the Trichomoniasis infection. Trichomoniasis is highly contagious and is known as one of the most common non-viral sexually transmitted infections today. The infection is spread through sexual activity from penis to vagina or vagina to vagina contact. It usually affects the lower genital tract in men and women. The most affected areas of the infection involve the vagina, vulva, cervix, bladder, urethra, and genitals. Signs and symptoms of trichomoniasis include discharge, itching and irritation, burning after urination and sex, and lower abdominal pain. Oftentimes, patients with trich will experience no signs and symptoms. If a patient is sexually active, they should always be aware and educate themselves on their risks. Trichomoniasis can be devastating in pregnancy. Infected mothers are at risk for going into preterm labor and having low birth weight. Conditions associated with trich include bacterial vaginosis and sexually transmitted infections. Men are also at risk for prostate. Screening for trich includes multiple sexual partners, history of STIs and trich infections, and having previous sexual encounters without using. Diagnosing trich involves testing vaginal secretions, urethral secretions, and urine. The NAAT is more accurate for testing secretions than a wet mount, and the APTIMA can test. The OSOM test is a rapid test with high specificity, and the wet prep is the most common test due to its convenience and its low cost, but it is fairly inaccurate. One treatment for trich is metronidazole or Flagyl. The patient's dose can be increased over time if infection persists and does not clear up. Another treatment is tinidazole. It is preferred over Flagyl because of its anti-parasitic with antibiotic combination therapy, but it is much more expensive for the patient. The most effective way to prevent trichomoniasis is abstinence. If a patient is sexually active, regular STI testing is warranted, especially if multiple partners are involved. Patient education should include prevention measures along with signs and symptoms of infection. Patients should also be educated on high-risk activities and sexually transmitted infection testing. If being treated with medications, patients should be made aware of the importance of medication dosing and I hope this educational video about trichomoniasis will help guide you in living a healthier, sexually active lifestyle.